people that started on our AI platform maybe 6 months ago are having a very different experience today, just because everything keeps improving, everything gets better, things get faster, and it keeps evolving, I would say. So I think in terms of the examination, in terms of recording your notes, summarizing the notes, doing all the referrals, the soap notes, all of that, it works pretty well on the platform.
We have a follow-up episode, and we have with us the wonderful Dr. Rania Saleh. Rania, how's it going?
Great. Thank you for having me again.
No, yeah, of course, definitely. Rania, real quick, for those who are new, you founded Oryx when?
We just had our 10-year anniversary, so exactly 10 years ago, and the team surprised me with a happy birthday cake. And I was like, what is it for? And it was for Oryx's 10 years anniversary.
Yeah.
So 10 years.
Man, and I know we've discussed this in a previous episode, and we're going to put it in the link in the show notes below. But real quick, in a nutshell, why did you create, or I mean, you were a practice owner before, right? You were working, doing everything. Are you still a
No,
practice ownership? Okay,
no,
so
not
you've
really.
sold it, but right now, if you can let us know in a nutshell, why did you make Oryx?
I started Oryx because I was very frustrated with the status quo. And I didn't realize how frustrated I was until I got pregnant. I was on bed rest, and my practice that was doing great started going downhill. And I didn't realize that I was the glue that was putting all the things together, on the systems that I had created could not be applied in my software. They were only in my head, and I could work with one individual in the practice at a time to teach them these steps. And it wasn't a process that we were following all the time. So as long as I was there and nudging everyone to do what they need to do, things were flowing nicely. When I wasn't there, it wasn't the same. And I wanted a software that could help me categorize things, could help me with checklists, could help me grow. And also on the clinical side, I had gone through the COIS Center and I loved John's teaching. I loved evidence-based dentistry. I wanted every patient to know what we're doing. I wanted to share it with patients. So in my early practice days, when I was a very, very small startup with a lot of time, I would create a report for every patient. And my dream was like, why can't the computer just do it for me? Or I have
Mhm.
their photos and the risk assessment, and they understand their treatment plan. That was part of the creation of Oryx.
Nice. Okay. So right now, let's fast forward to today and looking back 3 years from now, what is the biggest belief you've changed in your mind since we last recorded regarding the growth of Oryx and people who use it?
A good question. The biggest change is how fast everything is evolving around us. You know, like you built Oryx, and originally I thought like I would build this version, this clinical version that would be amazing. Everyone would use it, would have systems in it. I would plug it into existing software and it's good enough. And that it wasn't enough for dentists. They wanted more. They're like, we want this to communicate with the patient. We want to send them the reminder through your platform. So we started adding, and I quickly realized that dentists are looking for a comprehensive solution, one platform that can do everything. So that
Mhm.
was my original thought, thinking that I could have a plugin and put in other software and it's going to work. And now knowing that dentists need a full platform, and with all of the AI changes, how do we implement this into Oryx? How do we look into the future? And part of it is very humbling because you have to say, like, this thing that I created or this module that I'm so, so proud of, I'm going to have to tear down and create something totally different. Because when you think of it as in an AI way, it has to change completely from its roots. So taking out pieces of the software and throwing away and putting something better sometimes is challenging.
Yeah. What did you underestimate about building a company versus running a practice?
There are a lot of similarities in building a company and running a practice. Like when I had my startup, it was just me and someone at the front, an assistant. And eventually we started growing. So we needed more systems. So we had an office manager, we had multiple doctors, and we had to create a lot more systems. And it's a bit similar in a company where you start with a very small team, you have this synergy, everyone is working together, and the company starts growing. And you have to create systems for things to be organized. Now we're serving thousands of practices. So what worked 7 years ago cannot work right now. So we got a lot better at creating systems, at getting everyone aligned on the customer journey, on the features that we're releasing, on our plans. And it gets harder as you grow to keep the culture and to keep everyone aligned toward the same goal. And the same thing happens in a practice when the practice grows very large. It's hard to keep everyone engaged and everyone focused on the same thing. So if your focus is really the patient experience, it's really easy to implement this when it's three people. When you go and you're like, Olivia, make sure you always answer the phone with a smile. Stop what you're doing. Look at them, give them a smile, ask them how their day is going. So it's easy to teach everyone this. But imagine you have a practice with 25 employees. How do you keep implementing these systems? How do you keep your patient at the center? And the same thing as we have a company with over 100 employees, how do we keep our customer at the center? How do we make every practice a VIP practice? How do we serve all our customers the way that they deserve to be served and keep our culture?
You mentioned that your employees, you want to make sure everyone's engaged and focused, they're aligned to the mission. How are you implementing that? Like, what are you doing? What are you kind of taking out or sharpening, pivoting? When has been the biggest growth spurt in Oryx internally with teams?
We've doubled year over year for the past 2 years, and we're set to double again. So it's been a lot of growth very quickly. And part of that was realizing that I got to a point where I cannot manage all this team and all that growth by myself. So it was really finding the right leaders to help me, and they are hiring the next generation of Oryx team members. So we invested heavily in our team in the past year. We have a new chief commercial officer, Taylor, you've met her, and she's also our chief people's officer. So she's creating that culture. She's creating that engagement. We just had our first ever kickoff in Dallas, Texas, and we had some of the teams fly to that because we're a remote company, for them meeting each other, being together, having that energy and telling them, reminding them what's our mission, what Oryx looks like today, what we're looking for to the future was really great. We hired a chief customer officer that comes from similar vertical industries and has scaled very large teams. So for her, it's amazing to look at our customer journey when we're onboarding someone. How do we onboard them very successfully? These are the nuances, like how do we onboard a startup versus how do we onboard 15 location office or 2 location office. So she created all these playbooks and is empowering the teams to do that. We have a new VP of product, so engaging more with our customers. And, we're very, very close to our users. But having a person just dedicated for that and not just me talking to some users, looking at some tickets and saying, this is going to be our next roadmap. It's really great to have someone dedicated to really be with the users and say, this is so important for all our users for the next phase, and having like a very solid roadmap for the next 6 months or a year.
Nice. Okay. So then, Rania, how do you find these right leaders, like the ones that you mentioned, right? Because I guess the same principles can apply in a practice, right? And you're a practice owner and you were one, right? So you can kind of relate. How do you find the right leaders?
Same way I've always done it. I've always had a lot of mentors. I always ask for help. I love to learn and I'm always learning something new. So like when I was a dentist, I had great mentors that taught me both clinically and also like connections in my area where you would start getting from your network. Like there's this great hygienist who just moved to the area and I don't need her. Do you need her, Rania? And I'd be like, yes, great. Let me hire her. So this type of networks, and the same thing in the SaaS world and in the development world, there are mentors, and it was through my mentors that I started meeting these people and engaging with them.
Gotcha. Interesting. Okay. So it's always good to have mentors. Looking back now to today, there's so many more practice management softwares. Would you agree or disagree?
Yeah, probably.
A little bit more options, right? What are your thoughts on that? As far as like more coming out, is it specific for a specific demographic? Like who would you say Oryx is specifically for?
I would say it's a good thing to have choice. It's a good thing to have a lot of software. And the industry has been for so long on on-prem software, and it cannot evolve unless there is this cloud movement. So as long as dentists are moving to the cloud, it's a good thing because you cannot grow, you cannot scale a practice, or you cannot scale as a company in terms of features if you're deploying once a year. A cloud software can deploy every week, every month, however sequence they decide to deploy new changes. So it's a much faster, much more agile way of growing the software. And with all the changes, people need to be on a cloud platform. So it's only natural that some of the existing on-prem software try to create their own version of a cloud software. But yeah, I see it as giving people more choice.
So with that, you mentioned that what's been tough is taking some parts of the system out, replacing it with AI, things like that. What are some unexpected things that you feel you thought 3 years ago, we would never take this out? We're always going to like leave this. And then now, as the future's here, you're like, I guess we're going to have to upgrade that a little bit or change it.
So it's a bit of my baby, the clinical exam.
Mm-hmm.
I mean, that's always been our differentiator. It's amazing. It's very systematic. It communicates. It gives the patient a great summary of their conditions. It's been like our signature. And now I have a lot of ideas on how to make it better with AI. But to do that, I have to break a lot of pieces. And I started weighing the pros and the cons. And I think it's totally worth taking it in the AI direction, although like the part that I was the most proud of in the software has to be changed, but I think it's for the better.
Is that the flywheel that you were kind of discussing?
That's staying, but how to get to it with some AI changes, it would make it a lot easier and a lot faster to do an exam. One thing I won't compromise on is having a good, thorough exam, because that really leads to the case acceptance, that leads to the referrals. People sometimes underestimate having a good examination. I'm just trying to make it easier for everyone to do it every single time.
So can you walk us through that, Rania? Like, what does a truly comprehensive exam look like? What must it accomplish, not just for the patient, but for the practice to grow?
So a truly comprehensive exam starts with a very good medical and dental history. And our medical and dental history are amazing. They're very engaging. They're very visual. The patient is clicking on pictures. Like if we're asking them, do your teeth look like this or that? They're clicking. They're very engaged in that. But it's that engagement that allows us to get a very comprehensive history. And I'm not telling someone that you're okay when they're not. I'm not telling someone, oh, you look great. And then they're like, what about the tooth that packs food? You put them back down and you're surprised. Yeah, there's a fracture on the distal that I didn't see. And now I have to backtrack. When I have this comprehensive history, I already asked them, like, do you have any areas that pack food? Do you have any fractures? Do you have any loose fillings, any issues? So I know what's happening. I think it builds trust when the patient tells you everything they're feeling. And it also prepares you if the patient's saying, I'm great, I have no problems, and you put the probe and the blood is gushing, like now you're going to approach it differently about their perio when you're talking to them about that versus someone who's aware, who's saying, yes, I have bleeding gums, I have periodontal issues. They're aware of their situation. So I feel it really starts with a very comprehensive medical and dental history. And then going through an examination that is comprehensive enough, but not overly complicated. So if someone is very low risk for airway, I'm not doing the screening. I'm doing like a very small screening, but not everything. If someone doesn't have problems with their jaw joint, and that's the beauty of the Oryx exam, is you can go as deep as you want or make it as simple as you want. But if you start going systematically through the tabs of the exam, in 7 minutes, you have very comprehensive examination. And that spits out a risk assessment, the wheel that you were talking about, that is telling the patient how they're doing in terms of their gum health, their teeth, their bite and jaw joint, and their spine. And they have a summary, they have their photos, they could go home, think about it. I've had so many patients go home and they're like, after I read this, I realized that, yes, the crowding on my lower teeth is bothering me. What can be done about it? And this way, I'm not pushing treatment on any patient. I'm simply telling them the issues that they have and they usually come asking for the treatment. So that 7-minute investment that I have on the exam, on creating that report, that communication with the patient, I feel is the most important in the practice, because this is what's going to get the patient to say yes to treatment. This is what's going to get the patient to bring their whole family member to tell their friends about me.
Mm-hmm. And so this is the 7 minutes that you're just talking to the patient about their...
That I'm doing the examination and reviewing their history. And we've timed so many dentists doing it, not just me, not just Dr. Coyce. We've timed a lot of dentists doing it. And the average was 7 minutes. It might be 5 for some, 10 for others. Once people get the hang of it, it's easy.
It's easy breezy. Interesting. So to you, from that, what are the most commonly under-communicated clinical findings?
I would say airway is one of the big ones. And sometimes it's just some of the questions in the medical history, like does the patient snore? Do they have restless sleep? A few questions would give you that indication, and you can save someone for that, like seeing erosions on the teeth and thinking, do I refer that patient to GI? What's the cause of this erosion? So I find airway, GI issues, and unfortunately, like cancer is not always diagnosed the way it should be in our chair. And again, like simple examination, if you're doing it systematically, it becomes a habit and you're always catching these things.
Yeah, it's super beneficial. So then I like how you mentioned you're not really pushing it on them. This platform kind of allows you to use the right language to communicate the risk without feeling salesy, because I feel like feeling salesy is
The worst thing.
that's where we stop, right? So did you find that that's what this has been aiding a lot with?
I think once patients understand the risk, they understand why you're proposing a treatment, and you don't sound salesy at all, because I'm telling you what I'm saying. It's just facts. So if I tell you once you get the report and you're going to see this and you're going to see your gums, and a lot of times people see this and they're like, are these my teeth? And I'm like, yeah, I didn't get other patients' pictures and show them in your chart. But people don't realize, are my gums that red? So like when you showed like you have these areas of bleeding, these areas of inflammation, your bone level is this, you have lost 4 millimeters at bone at your age. This is not how it's supposed to be. And this is when they're asking you, what should I do about it? And you're like, a simple cleaning cannot go that deep. That's why we have to put you on a more serious periodontal regimen. And this is the typical protocol. And the beauty in Oryx is we have the evidence-based protocols baked in, but if you want to change something, you can change it. And if a patient is perio stage 3, the protocol is already there. So you don't have one hygienist treating the patient a certain way, another one differently. We're all committed. And this goes back to the alignment. Like if everyone is on the same page, like this is what we believe in our practice. This is how we're going to treat perio patients. This is how a perio patient stage 2 is going to be treated. A patient stage 3 is going to be treated. And this is the language that everyone knows. And if they start reading the risk that we give to the patient, I had every person that worked for me read these for about 20, 30 patients. And then we're all speaking the same language. They don't hear one thing in the back. They go to the front and they're like, do I really need the deep cleaning? Or do I really need this? And everyone knows, like, if you're perio stage 3, this is very serious for your overall health. We need to get that inflammation down. We need to get you back to a healthy stage. And this is what we're committed to do with you. Patients love it.
Interesting. Did you notice that a lot when you were practicing with Rania? Like in the back, or you told them like, you need this. And then they would go to the front and they're like, do I really need it? And then maybe your front office would say, unknowingly, maybe they would say like, you can wait or something. You know, it's almost like they trust the front a little bit more. Do you notice that?
You know, in my associate job, it happened a few times where I would recommend a crown and the patient would go to the front and, you know, maybe they know them, maybe they want to have them or something. And they're like, don't you just do a filling? And maybe in 2 years when things are better, because sometimes, you know, they know the patient better and they're like, maybe when your finance is better, you'll do the crown. Just go for the filling. And it happens a lot in practices where the front undermines the decision of the clinician. And now when patients hear what they wanted to hear, who they're going to trust next time. You're going to go to
Hmm.
the front desk person and do you think I should do the deep cleaning? Do you think I should do the ortho? And now they lost trust in that dentist. So that's why I feel like when you show them that evidence, when you tell them why you're doing what you're doing, you're not just pushing treatment. One of the best things that I learned, and that was a huge practice builder, was how we talk about a crown versus a filling that we just mentioned. Like, do you want to seal and protect your tooth? Like your tooth is structurally compromised. If we put a filling and it would be a tooth colored filling, that would just be sealing your tooth. So we're removing the decay, it's sealed, it's in good shape, but with the biting forces, with any other forces, it's not protected. If
Hmm.
you want to seal and protect your tooth, we need an onlay or a crown. And
Yeah.
people think, do I want to just seal or seal and protect? And for some patients, it's okay to say, I just want to seal it and I'll take my chances. But when that tooth breaks, they're not going to come to you with the bag and say, your filling broke.
Yeah. That makes a lot
They're
of
going to
sense.
say, you warned me. I know it. I chose the filling and now I'm dealing with the consequences. Or it might work out, but at least if a problems happen, you were upfront about it.
Interesting. The undermining part, how do you see that now in a company with team members?
I don't want to say we don't have it in our company.
That's perfect. That's great.
But I think when you have very clear goals, very clear alignment, and it's the same, like some patients are not the right patients for you. Some customers are not the right customers for us. And some employees are not the right employees for us. As long as everyone is clear on that, we don't have these issues. No one has to undermine someone else in
In the
our
team.
company.
Hmm.
So like people know that this is the vision. They know that these are the leaders, these are the managers, and we're all working towards the same thing. So we have a very, very collaborative environment where no one feels that I have to undermine someone as long as our goals are clear and everyone is working towards them. If someone feels that I disagree with my manager, they know who to go to and who to talk to, and we resolve it the same way that we're talking. You think you should solve this way? Do you feel this aligns with our mission? Do you think this will align with our goals for the company, our goals for our clients? And they think about it and they're like, okay, my manager was right. This is not the right approach. Or the manager might be wrong. And then we would say to the manager, your employee was right. Like this was what we're supposed to do to this customer because that aligns more with what we believe in.
Interesting. So do you, Rania, look in a lot of the leaders that you're hiring? I feel like the quality needed for that would be like humility and modesty, knowing like, hey guys, I may not have, you may have the better answers than me, right? Kind of a thing, but like show your work if you do, kind of a thing. And then modesty to know I may not be able to handle it all, so I need that other team member to come in with me, right? Would you say those are like it?
I totally agree. And I feel everyone in our company is thirsty to learning. It's a new industry for a lot of them. So if you don't have the humility, you cannot work at Oryx. So for someone that came from a similar platform for lawyers or for property managers or something like that, they have to learn dentistry. So you need to have the humility to go to someone who's working as a level one support, but who was managing a dental practice before and ask them questions and learn from them. So everyone is learning from someone at the company because either they don't have the dental knowledge or it's different skills, different departments. And I feel that disconnect happens sometimes in practices where we create that separation between the back and the front. Like the back only does this, the front only can do this. And why did the back not do this for us? And I don't feel we focus enough on the vision of the practice to say we're all working together. We all want the practice to grow, to be profitable, for our patients to be happy and healthy. We're all here for the patient at the end of the day. We need to work together. All these fights don't lead
Yeah.
us anywhere. And the same mentality happens in the company where it's like so many different departments. We're all working together. We're all working for the good of our customer. We need to align. It doesn't matter which team made a
Yeah.
mistake. Let's all fix it.
Yeah, no, that's fantastic. To you, with that being said, what is like the ultimate goal for the user that you want?
I want every practice to be very successful and for every practice to grow. So growth is really important. And also for the practices to serve patients the way patients deserve to be served. So like the evidence-based side of things, it's really important for me. I feel every practice should do it that way because it is the right thing for them and for their patients. And you feel so much better when you know you're doing the right thing. And I feel we enable people to do that. For a lot of dentists on our platform, they never imagined the growth that they could have. And like we're always rooting for them and cheering for them. And we feel people that are coachable, people that do the right thing, do amazing stuff. One dentist, he was a startup, super, like amazing, super smart. He went from zero to about 500,000 a month in a year. Just
Wow.
systems, protocols, organized, like amazing growth and great reviews, patients extremely happy. And a lot of startups cannot imagine, like, I'm going to go from zero to a 5 million practice after year one. That's crazy for most people. But we've seen it happen. Another dentist, 2 million first year, startup.
Wow.
And you think these are very odd cases, but these are people that believed in the system and were implementing the systems. And we see these success stories. I'm not just talking on the financial side, but also on their patients, how they grew the patient population, how they built the practice they always dreamed of. And these two practices that I told you about are completely different, like very different patient profile, very different demographics, very different areas. But they were able to do it because they had like a very, very clear vision. They used the software like it was intended. And they say it open, like I'm not just saying that, but they said like the software helped them with all their systems, implementing these systems grow. For one of them, the risk assessment was the huge practice builder, and it was a fee-for-service practice, and people saw the value and referred so many patients, kind of similar to my practice. The other practice was an insurance practice. It was more creating all the systems in Oryx that helped them grow. So very, very different approaches.
Interesting. So then you mentioned like if you would just follow the system, if we're following the system, what is the system?
Some of the system is the exam that John created, but the system is basically following what should be done for every patient systematically without thinking about it. Getting the medical dental history forms, all the forms that you need ahead of the appointment, following the checklist. Did we get the consent signed? Did we get what we need to be done? Do the exam the way it should be done? Do the treatment plan? I'll say we made it a lot easier now because we automated almost all of that process. And that's one of the big changes that we've worked on for the past year and a half is a lot of the things that people don't like to do, like reminding the patients, getting the collection right, all of that we automated. So I would say now if people invest the time to automate the system the way that it should be done, and you work with an onboarding specialist for that. So like when we get the payment back from the insurance companies, do you want to turn on the ERA and everything automatically posts? Yes, then we turn it on. After that, if the patient still has a balance, how do you want to remind them? Let's start with a really soft message. Let's start with a text, another text. Let's go for an email after that. After 45 days, do you want to send like a more stern email or a text? And that's very different on demographics. Like some people would say, oh, I worked in an area where everyone is a young professional. Let me send them 7 texts, 7 days in a row. They're going to answer one and that's it. Others would be like, no, it's more families and my patients respond to this type of messaging. So once you automate all of that, the patients get the message, they pay, it automatically posts into Oryx. No one has to go and manually do any of that work. If you do a treatment and you finish it, the post-op, the pre-op, all of that happens automatically. We've worked a lot on the voice where you do the voice exam and then on the chart is filled for you. The way I think about it, and this is the part that I told you I had to gut a bit from the software to do it differently, is if I have my best assistant with me, how does my day go? When I have my best assistant, I'm just saying, I have filling here. It looks like it's leaky. Let's put a crown on number 13. Number 14 has some sensitivity from that recession. we're going to watch it for now, and I'm going to refer the wisdom teeth for extraction. Let's send them to Dr. Josh, and I'm done. And usually my assistant Shanika would go and send all of that and like send the referral, do everything. Like I just finished, walk out of the room, it's all done. Now we're getting the AI to do all of that. And I don't have to talk a certain way. I don't have to speak weird. It just understands and puts the information where it needs to go. And these are the systems we're constantly improving on. Thinking about all the systems that need to be implemented, things that we before had to train people to do, how can we automate more and more of it? And how we can allow the team to be very focused on the patient, to have that nice conversation and not be on the phone with the insurance or answering a million emails at the same time when they're talking to a patient.
Yeah, interesting. I know there's a lot of incredible features and benefits that you have. I know at the beginning when we did our first interview 3 years ago, it was something else. Looking now, what would you say most of your users are like, "Wow, this is incredible." This specific, I mean, there may be many features, but one specific like feature that causes an incredible benefit.
I think right now the AI features are mind blowing, like on the voice exam, on everything that we're doing with voice and on the automations. We have 3 tiers with Oryx Pro, which is the regular Oryx that we've been selling for the past years. Automate would have all the automations like the insurance eligibility that autofills, the payments that auto post, on the reminders that you can sequence any way you want. A lot of workflows that are built into that. That's our second tier. And our third tier is the AI that would have the AI exam, the AI voice perio, the annotations on the radiographs, all of that. And we're finding more and more people are gravitating towards AI because people are seeing the value of that.
I believe Pearl was with you guys. Do you guys have more integrations now?
Yes, so when you go on our AI tier, you can choose to have your radiographs annotated with Pearl or Overjet, and it happens directly inside of Oryx. So that's another part about having one platform, about being all integrated, is the dentist doesn't ever have to leave the platform. So they're not clicking on a standalone software to look at their x-rays, to annotate them. It's all within Oryx. And one of the workflows, for example, is we auto attach and auto send the annotated radiographs to the insurance companies. Things like that you cannot do unless you have a cloud system, unless you have a comprehensive system, like a more advanced system.
Yeah, interesting. That's fantastic then. So, if we're talking about startups right now, if you were opening a startup tomorrow, what systems would you build in the first 30 days?
I would say the software choice is so important because it's the basis of so many other choices. Once you choose your software, you know a lot of the other things that you need to get, the x-rays, all of that. And a lot of people have the misconception that maybe I should start with a simple software, something so easy that anyone can use because I don't have that many patients. And I would say, that's the biggest misconception because these software don't grow with you. Then in 2 years, when you have patients, when you have a busy practice, you have to convert to something more robust. We see a lot of people outgrow even some of the new software that are on the market very quickly and have to migrate to us within 6 months, a year. So I would say choose a platform that can grow with you, that can support you. So maybe I don't do the airway exams now. Maybe I'm going to do it in a year. And it's important to have a platform that has this. Maybe some reports I don't generate now because I'm so small, but in a year, I'm going to need to generate all these reports. The automation might not be very important to me right now because I'm only sending 5 claims a week. But when I'm sending 500, I want all of these automations built in. So I would say when you create your systems, don't think about your practice now because that's the smallest you're going to be. And this is what we say about our company every day. This is the smallest we're ever going to be. We're going to keep growing. So think about how your practice is going to look like in a year or 2 years and start building systems for that. And it's hard sometimes when you're just starting to envision how it's going to be. But I would say the first questions to ask is, what kind of practice do I want to have? Do I want a fee-for-service practice? Do I want to take insurances? Do I want to see children, not see children? Like start deciding the type of practice that you want to have. And then what do I believe in? Do I believe that every patient is VIP and I'm going to treat them as such and we're going to give them white glove service and we're going to spend time talking to them and we're going to call them after every procedure? If I'm doing that, I cannot have a very high volume practice. Then that leads you to think, can I take on these insurances and still give that type of service? Or do I want a practice that is focused, I don't know, on ortho, on airway, on something different? And does every decision feed into my vision? And every time you're making a choice, if I decide that I want a very kid-friendly practice, when I try to make a choice about something, I would say, does this look kid-friendly or not?
Mhm. Yeah, kind of always have your core values in the back of your mind. So the first 30 days, you'd say like, hey, think about the future, but at the same time, have your core values set so you know how your future is going to play out in the sense, right?
And you have to figure out how we're going to market. How are we going to get patients in the door? I mean, that's your specialty. And it depends on areas where you're at, what type of patients you're trying to get. You're going to do different type of marketing. When patients come in, am I going to do a comprehensive examination? Am I going to have the hygienist do the exams? Like, just work it through your day. Who's going to do the exam? How are we going to be presenting the treatment plan? Is it going to happen in the chair? And if it's in the chair, do I want iPads in the chair? Or do I want to take them to a treatment room to show them the treatment? And I've seen it done successfully so many different ways. One of the offices that we have do everything in the treatment room. They're so busy, so big. Every room has a payment terminal. When people come for hygiene, they're scheduling the next appointment, they're taking the payment. The patient is signing everything they need to sign on the iPad in that room. And that's it. They walk out of the door. Same thing for treatment. All the assistants are trained to take payments, give them all the post-op instructions, do everything that they need to do, and the patient just walks out. So I've seen that done very successfully. I've seen offices where people go to a separate room to pay, like a separate treatment presentation room. So just decide how you want to do it, work out your flow to see, are we completing the procedures in the front or are we doing that in the back? And like one of the things in Oryx is you can complete your procedures in so many different places of the system. So if you're completing it in the back, we make it so easy. In the back, you can do it in the treatment plan, you can do it from the progress note. And to be honest, this is my preferred method because the patient, if they're paying whether in the back or in the front, they go, no one is coming back to ask you, what did you do today?
Yeah.
It's all there. But if you're going to do it in the front, you just click on the scheduler, you have the procedures, you can complete it from there. So I think like people don't think through these systems. They learn one way, they implement it, and then they're like, oh, the flow is clunky. I don't like how my office is working. I would say think about these flows and then decide, because there's a way to do everything you want to implement. Just put your vision. I envision everything to happen in the back. This is the flow of my patient. And then you make the software work for you.
Yeah, interesting. Okay, so that's the huge benefit then, right? When you think of it like that, instead of thinking, man, Oryx has a ton, it may require a lot of training, or maybe my staff may feel frustrated at times with all the features and everything, but really it's for flexibility because it's, hey, how's your workflow going? And we're not going to get it right always the first time. It's going to continue to adjust. And even when we do get it right, 3 years from now, it's going to adjust again because of the times, right? Maybe people want to pay through their phone now or other ways, right? And so Oryx kind of adapts to that. It adapts to the workflow of it. Do you guys have like an onboarding training as well?
Yeah, we have very solid onboarding and training. And now with our new chief customer officer, she's changing some of these workflows to be more of a consultation with the office to understand their flows and to make it like instead of teaching you 10 different ways of doing something, we're just teaching you the way that would work best for your practice. So we're seeing a lot of success with that.
Yeah, that's really good. Super like hyper focusing on that. So then, Rania, to you, looking at it from a bird's eye view, especially AI, like what have you seen that's been real versus just a bunch of hype when it comes to AI in clinical dentistry?
I think like the annotations on radiograph is amazing. I mean, it's not 100% correct. You just need to know how to work with it. That's been tried. It's true. It's there. A lot of people are using it and seeing the value out of that. So I would say for anyone that is not using annotation on the radiographs, they need to do that. I think all the voice recording of the exam, all of that has a huge success. So I don't think that's hype at this point. And I would say the models are constantly improving. So people that started on our AI platform maybe 6 months ago are having a very different experience today, just because everything keeps improving, everything gets better, things get faster. And it keeps evolving, I would say. So I think in terms of the examination, in terms of recording your notes, summarizing the notes, doing all the referrals, the SOAP notes, all of that, it works pretty well on the platform. I would say the bad thing about AI is when it's not trained properly and it doesn't work. So that's why we're investing so much in training our models to really do what they're supposed to do. And I mean, the running joke in the office is like, I wanted to be Olivia, my assistant that understood everything when I barely talked. Like, that's how I wanted to be. And I'm like, no, 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 it's not like talking to a human. I just needed to do everything I wanted to do. And that's really the test. And they keep saying, like, it's not going to do that. And I'm like, no, no, keep fixing it until it understands. And there were some nuances because I'm like, a dentist could say, I'm going to do this. I wanted to understand that that's a treatment plan.
Mm-hmm.
Yeah, we did the filling last year. That's already in the existing. It looks like this has been done. So like understanding all that language, understanding what should be done as a treatment, what's an existing, what's a referral, with just having a conversation. These are the different things that I love teaching. They are.
Yeah. Nice. Okay. That's interesting. So then one of the last questions we wanted to ask you is if a listener implements only one thing we've discussed tomorrow morning, what should it be?
I think one easy thing is to go look at your systems. We're all busy. The office is constantly working. There's this constant chaos, but somehow we make it at the end of every day and go back the next day and do it all over again. I would say take a step back and look at your system and say, is this the practice that I want? Are the systems working for me or not? Is my software slowing me down? Can I make simple changes in how we do the handoff between the front and the back that would make the whole experience a lot better for our patients? And commit to changing one thing maybe every week, every month, every quarter. And these tiny changes compound. So if I just change how we get the patient intake this month, and by next month, like it becomes a habit, part of our workflow, and then we change how we present a part of the treatment plan. If you just do one change a month, at the end of the year, you have 12 changes that would transform your practice. If you do it every week, that's a lot more. So I would say like just go review your workflow and think where you can make improvements.
Incredible. That's great advice. So thank you, Rania, so much for being with us. It's been a pleasure. But if our listeners wanted to find you, talk to you, where can they find you?
Yeah, you can follow us, oryxdental.com. We're on Facebook, Instagram, everywhere, LinkedIn.
Everywhere. Gotcha. So I'm going to put that in the show notes below. And Rania, thank you so much for being with us. It's been a pleasure, and we'll hear from you soon.
Thank you for having me.